Good evening, everyone. Today, I have the pleasure of having Dr. Debayan Banerjee. Dr. Debayan Banerjee has secured a stupendous and fantabulous rank of All India Rank 4 as far as this recent INICET May is concerned. Congratulations, Debayan. Happy to have you here. How are you feeling?
Well, a very good evening, sir. It's been an absolute pleasure to talk to you today. Yes, the feeling is definitely great. It took a while to sink in since yesterday
All
because I was not expecting a rank of 4 because I felt that the exam could have been a little better. But, once I got the result, I was really over the moon. So, feeling very happy right now.
great to know that. Exactly. So the single digit rank, obviously the dream of everyone, anyone who's preparing for this INICET or NEET PG for that matter of fact. Great, Debayan. So a little bit of introduction about from where did you do your undergraduation from, Debayan?
So, I have done my MBBS from State GS Medical College and KEM Hospital in Mumbai. I am from the 2019 batch. And I have finished my internship in the month of March.
Oh, great. So this was essentially your first attempt post internship.
Yes.
Right? And in the very first attempt, you have gotten this amazing rank. Good to know that. So, Deepan, you were a test and discussion student of DBMCI, right? You were an online live test and discussion student of DBMCI. So I'll jump right into this. I personally myself was a test and discussion student. So from the horse's mouth, for someone who has gotten All India rank 4 this time, what do you think are the benefits of a test and discussion student? And when did you take this test and discussion? And for whom you will advise you should take test and discussion, whom is like, okay, they can maybe leave it also for that matter.
I would say that for me, for the entrance point of view, is it was in the middle of my third and fourth year when I made up my mind that I will appear for the entrance exam post my internship. So that was the period of time I had watched a little bit of the videos which were available. I had made a little bit of notes of the subjects of the third and fourth year. And like when I've come to my internship, I was at a phase that I was prepared to some extent in some subjects, but there were some subjects wherein I had forgotten things, where I was not having a proper set of notes with me, and I needed some polishing and revision. So that was my thought process behind when I had decided on taking up the test and discussion, because the test and discussion at least will ensure that it provides me a set of notes of the at least the most important and the volatile stuff in the run up to my preparation for the INICET exam or the NEET exam per se. So that was my thought process when I took the test and discussion. It was with the aim that at least through a set of 100 or 150 questions, I'm able to revise a particular subject and make note of the areas which are frequently tested for that particular subject. And I have a set of notes ready with me, which I can obviously revise in the future as well.
Great. So that's how I think a test and discussion perfectly should be used. Like, in your internship, you'd already done the third and fourth year. Like you said, you had already notes and you had done those in the third and fourth year. But you needed something, like you said, polishing and refinement, right? So that at least the revision part, the volatile stuff, at least you are able to revise as far as of your weak subjects. You have certain notes which you can revise towards the end. And even for the better subjects, at least you can test yourself and get a refined polishing and the most important topics from the from the experienced faculty, so that those are the ones which you can focus upon, especially given your hectic internship. And that's how you utilize the test and discussion, and that's how everyone should. If you are someone who has prepared a little bit decently over a occasion your third and fourth year, I would advise anyone that in the internship they should go for a test and discussion, get that refinement done, and hopefully secure as good as a rank as the Payan has. Right. So next question, who are your favorite faculty as far as Bhatia was concerned, Deepan?
Some of the faculties who stood out during the course while I explored this test and discussion definitely was in the subject of ophthalmology, Dr. Neha Agarwal ma'am. Actually, ophthalmology is one of the subjects which I felt was a little difficult for me to understand and remember stuff. So, ma'am, test and discussion, she made it very easy because she covered basically almost all the important stuff which is tested from ophthalmology. And ophthalmology, I feel, is a scoring subject. Once we understand the terminologies, and it has a limited set of topics and areas which are tested. So it has been covered in a very crisp and beautiful manner in the test and discussion. And another faculty who stood out for me was Dr. Thamim Saif sir. I had done his test and discussion for certain systems, like especially the cardiovascular system and the respiratory system. So that I was a little weak in those areas. So attending the test and discussion definitely helped me gain a little more perspective and a little more understanding towards those systems in particular. And in the run-up to the exam, maybe in the last fortnight or so, I made sure that I revised Dr. Ashwini Kumar's cadaveric-based videos, so that because I knew that anatomy is definitely playing an important part. So that I made sure that I revised anatomy in the run-up to my exam, as a result of which I used the Dr. Ashwini sir's videos.
Great. So three faculty, especially, and I think all the three are, if I'm not wrong, like all the three subjects that you focused upon are especially very important as far as INICET is concerned. Like that's one of the major scoring points as compared to NEET PG. Like, okay, medicine is important in both the places, but anatomy, the weightage of in INICET is way more. And that's why you did those use Ashwini sir's videos, and same for Opthal also. More weightage in INICET as compared to as far as NEET PG is concerned. All right. So when did you complete your first reading per se? And what was your revision plan after that? How did you use, how many GTs that you gave? A little bit about that.
Well, sir, when I came to the initial part of my internship, when I was starting about with my internship, it was a time when I had just given my final prof exam. So the final year subjects were a little fresh in my mind. So as a result of which I started in my internship with the first and second year subjects, because those were the areas where I had not revised it in a long time. As a result of which they needed some brush up. So my initial goal was to just give a quick read of the first and the second year subjects, doing that part, because I felt that if I'm able to do the first and second year subjects well, the understanding of the third and final year subjects become much easier. And we all know that INICET is definitely much more inclined towards the first and second year subjects as compared to the NEET exam. So, I made it a point that I do those subjects very well, so that I'm able to have a good grip of the subject in general, as well as my other subjects understanding become much better. As a result of which, the first 3 or 4 months, maybe I did my first and second year subjects revision. And after that, once I was a little confident that the first and second year subjects are now good, having a good retention and grip over them. It was the time when I again then revisited my third and fourth year subjects, third year especially because there were subjects like TSM which were very volatile, a lot of facts, a lot of stuff to remember. So that I made sure that I just again went through them so that, just to brush up my memory and just, remove the dust. And the final year subjects is when I've touched it a little later in my internship. So that it was, I feel, around the month of maybe September or October when I had completed a first proper reading. And the time post that was only for revision.
Only for revision. So what was your first GT score? When did you give your first GT?
Well, sir, I gave my first GT a little earlier. It was, I would say, when I was in the middle of my final year.
Okay.
But the goal that time was never to gauge how well I have prepared. It was just to get a feel of, how a GT is, like how it is to attempt 200 questions. That time there was no system of blocks per se, so I just tested that like with even if I'm going unprepared, how many questions I'm able to do out of those 200. So initially GT ranks were a little lower, maybe 4,000, 5,000, maybe just 110, 20 correct. But then gradually, as I build on, I came to the end of my final year. In the beginning of my internship, my GT scores ranged from somewhere between 145 to 150. And that was again the time when I just brushed up, watched the test and discussion, covered those weak gaps in my knowledge. And as it progressed, I made sure that from GT to GT, I target an improvement of about 3 to 5 questions. So and coming to my last GT, which was before my INICET, I had about 180 questions which were correct. And so my rank was, I think, 14 or 15, the last GT.
Great. Yeah. And so what was your revision strategy? You said you had completed your revision by October, November. How did you plan to go in the next 6, 7 months to revise? And especially the last 7 to 10 day revision, when everything needs to be revised. How did you go about that? Did you have a list of topics? Did you make another set of notes? Or did you anything else that comes to your mind? Especially people are able to do the first reading properly, but they falter in revision. So anything about revision about that?
Well, sir, once I'd finished reading the subjects for the first time, I knew that there were certain subjects which were a little concept based. For example, take the example of physiology or medicine, wherein I made sure that I spent a little more time in my first revision so that I don't have to come back to that repeatedly. So there was a set of subjects like that which I had prepared in the manner so that most of it was covered. Just about maybe 10 to 15% was there, which I had left for the a little later. So coming when I started doing my second reading, it was more focused on the subjects which were more volatile, subjects like surgery, OBGY, PSM, ENT, ophthalmology, FMT for person, because these are subjects which were a little volatile. There were a lot of facts involved, so that I made sure I gave another fresh reading of all those subjects. I did not make a fresh set of notes per se. I used to underline in my the notes which I had made from my third and final year. I just made sure that I highlighted those important stuff. And like after my second reading, I also made sure that I have a list of particular topics for each subject, uh, which included the very volatile things which I tend to forget, or maybe I was making mistakes in my grand test. So I made a list for each of those 19 subjects, and I made it a point to just, along with my day study, I just picked up one subject and did those weak areas in the future sessions.
All right. So basically, you had two things like, conceptual subjects, you gave more time so that towards the end, you don't need to give time. And as far as the volatile subjects are concerned, you made a list of the topics which you will keep on forgetting. And you picked up one topic or one subject on a daily basis and kept on revising it again and again. So that it just kind of, stays in your mind forever. All great, great. So with this rank, you'll essentially get any specialization. What's your specialization in mind, Debayan?
I'm in a little bit of a debacle between surgery and medicine. I'm just
Okay.
to some
Oh,
of my.
two radically different choices, surgery or medicine.
I was inched towards surgery, but now I am feeling that maybe I can also
Because
choose.
you've got a good rank, so now you're thinking you will take medicine. That's not how it works. If you like surgery, I would say go for surgery, and don't change your branch just because a lot of times people do end up doing that. That they get a rank, then everyone around them ends up pressurizing them, take radio, take medicine, take derma or things like that. Don't if you're someone who was destined to become surgeon and you're someone who has that orgasmic pleasure of doing a surgery, I'm pretty sure you must have attended some surgery, then be a surgeon. The country requires surgeons. And more importantly, with the advent of AI, I think only the surgeons will survive. So, right. So don't do that. But yeah, take your call, whatever you want to do. Obviously, I'm not going to pressurize. Nobody's going to pressurize you into that. And whatever you do, I'm pretty sure you'll be successful in that. No doubt about that. All right. Any specific message for people, before we move towards a rapid fire round? Any specific message for people who are in their internship right now, first? Second, who probably have completed their internship and would appear maybe in the next November INICET and next NEET PG. Any specific messages for them?
Well, for someone like who are just initially in the internship, just going about it, I would just say take a couple of days or maybe 2 or 3 days to just get an idea of where you are currently, because your current level of preparation, subjects which you're weak in, subjects which you need a little bit of working on, or maybe you are someone who has not done that much of preparation during your prof times, and you want to just start afresh from your internship, and aiming a serious attempt towards the coming year's session. So for someone like that, I would say you can always go with a test and discussion, because the test and discussion, it will provide you with a crisp set of notes, because internship is a period where you can't spend a lot of time, devote a lot of time, make a very exhaustive set of notes, because you have a limited amount of time and there are 19 subjects which are to be done. So you need a resource which is short, crisp, and revisable towards the end. So my advice would be to, enroll for a
Join
test.
a test and discussion. Enroll in a test and discussion for anyone who's in there in internship. Yeah.
And
All right. And
like for someone
hmm.
who's targeting the November session per se, I would say that uh, maybe the people may have done their part appearing for this session as well. So just go back and just see where the areas you need a little bit of working, where you can need a little bit of polishing. I know that some subjects for those particular individuals, like some subjects may be very strong. They may be a strong in particular subject, and towards the end they could not have revised a set of particular subjects. So I would just say work on those areas where you have not revised things at all. Maybe you are very weak in those subjects, so that in the run up in the next 6 months you are strong to go with it.
Great. So before we end, and just a small rapid fire that I would ask you, right?
Okay.
So, what was your favorite study snack when you were studying? What was the first favorite snack that you had?
Well, it was brownie.
Brownie, great. Anything random that you did on your exam day for good luck?
I had a maroon T-shirt which I had worn for all my quizzes in MBBS, all my proms. So I just
Great. Even I had a red T-shirt. I think that's red and maroon is
one.
all right. Anytime during your internship you felt नहीं हो रहा अब तो हो ही नहीं रहा भाड़ में जाए.
Well, not once. maybe बहुत बार मुझे ऐसा लगता है कि नहीं होने वाला है. But again, just made sure how
How did you motivate yourself in those times of panic?
just took a little time off from studies, chilled around a little bit, watched something on YouTube, talked to some friends. Again, जब थोड़ा mood अच्छा होगा, again went back slowly to study.
All right. So do you have a girlfriend?
No, unfortunately.
Next question was going to be that whether a girlfriend is a distraction or a motivation, but okay, you don't have a girlfriend, so not going to be. And did you delete the social media, or you were a social media fanatic at this point of time?
I at least spend about 2 to 3 hours every day on social
On
media.
social media. What
Last
was
year.
the longest? What was the longest time you went without social media? Let's say went without Instagram, in the run up.
It's on my phone from the day I joined MBBS, and it's there even now. So I have never. I can control my urges.
Can control your urges. Great. Thank you. That was a wonderful session, Debayan. I thoroughly enjoyed talking to you. Congratulations once again, right? All India rank for a single digit rank is obviously a dream come true. Congratulations to your parents as well. I know that your parents also must be feeling really proud and must have contributed a lot to your success. And thank you. Thanks a lot again. So one final advice from my side, like Debayan has already said that, internship, you don't have that much amount of time. And joining a test and discussion definitely is going to be beneficial. We'll give you that crisp, concise notes and important topics, and do join that. Thank you, Deepan.
Thank you, sir. It was lovely talking.
Thank you.